Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
The primary goal for the client with Buerger's disease is to prevent 1. Embolus formation, 2. Fat embolus formation, 3. Thrombus formation, 4. Thrombophlebitis. The correct answer is 3. Because of the inflammation. A common complication of Buerger's disease is thrombus formation and potential occlusion of the vessel. Inflammation of the immediate and small arteries and veins is involved in the disease process. Embolus is a potential risk if a thrombus has developed. Fat embolus is associated with fractures of the bones. Thrombophlebitis occurs after thrombus formation. Which of the following clients is at greatest risk for Buerger's disease? 1. A 29-year-old male with a 14-year history of cigarette smoking. 2. A 38-year-old female who is taking birth control pills. 3. A 54-year-old female with adult-onset diabetes. 4. A 65-year-old male with atherosclerosis. The correct answer is 1. Buerger's disease is a non-atherosclerotic, inflammatory vaso-occlusive disorder. The disorder occurs predominantly in younger men, less than 40 years of age, and there is a very strong relationship with tobacco use. Diagnosis is based on age of onset, history of tobacco use, symptoms, and exclusion of diabetes mellitus. A client with Buerger's disease smokes 2 packs of cigarettes a day. When helping a client change smoking behavior, it is important to know the clients. 1. Ability to attend support groups. 2. Goals for the treatment. 3. Perception of the negative behavior. 4. Motivation. The correct answer is 3. When helping a client change detrimental health behavior, it is critical to learn how the client perceives a situation or problem. The client is more likely to change detrimental health behaviors if he realizes that there's a problem and that these behaviors lead to the problem. While understanding the client's ability to attend group meetings, his goals for treatment, and his motivation may help facilitate change, the nurse should first understand the client's perception of the problem and then determine what strategies might work from his perspective. A client with Buerger's disease has established a goal to stop smoking. Which medication would be the most helpful in attaining this goal? 1. Bupropion. 2. Nicotine. 3. Nitroglycerin. 4. Ibuprofen. The correct answer is 1. Bupropion is used to promote smoking cessation. All types of nicotine should be avoided to prevent vasoconstriction. Nitroglycerin, used for angina, and ibuprofen, an anti-inflammatory medication, have no role in smoking cessation. The nurse is assessing a client with Buerger's disease. The nurse should determine if the client is experiencing 1. Thickening of the intima and media of the artery. 2. Inflammation and fibrosis of arteries, veins, and nerves. 3. Vasospasm lasting several minutes. 4. Pain, pallor, and pulselessness. The correct answer is 2. Buerger's disease is characterized by inflammation and fibrosis of arteries, veins, and nerves. White blood cells infiltrate the area and become fibrotic, which results in occlusion of the vessels. Signs and symptoms include slowly developing claudication, cyanosis, coldness, and pain at rest. Thickening of the intima and media of the artery is characteristic of atherosclerosis. Vasospasm lasting several minutes is characteristic of Raynaud's disease. Pain, pallor, and pulselessness are symptoms of acute occlusion of an artery by an embolus or other cause such as compartment syndrome.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanursguide.com. Back to the questions.
The nurse is caring for a patient with carpal tunnel syndrome who has been admitted for surgery. Which intervention should be delegated to the assistive personnel? 1. Initiating placement of a splint for immobilization during the day. 2. Assessing the patient's wrist and hand for discoloration and brittle nails. 3. Assisting the patient with daily self-care measures, such as bathing and eating. 4. testing the patient for painful tingling in the 5 digits of the hand. The correct answer is 3. Assisting the patient with daily self-care measures, such as bathing and eating. Rationale. Helping with activities of daily living is within the scope of practice of APs. Placing a splint for the first time is appropriate to the scope of practice of physical therapists. Assessing and testing for paresthesia are not within the scope of practice of APs and are appropriate for professional nurses.
A child's parent asks the nurse what treatment the child will need for the diagnosis of strep throat. Which is the nurse's best response? 1. Your child will be sent home on bed rest and should recover in a few days without any intervention. 2. Your child will need to have the tonsils removed to prevent future strep infections. 3. Your child will need oral penicillin for 10 days and should feel better in a few days. 4. Your child will need to be admitted to the hospital for 5 days of intravenous antibiotics. The correct answer is 3. Your child will need oral penicillin for 10 days and should feel better in a few days. The child will need a 10-day course of penicillin amoxicillin to treat the strep infection. It is essential that the nurse always tell the family that, although the child will feel better in a few days, the entire course of antibiotics must be completed. Answer 2 can be eliminated because it is a treatment for recurrent tonsillitis, not strep throat. Answer 1 can be eliminated if the test taker understands that bacterial infections need to be treated with antibiotics. A nurse witnesses an accident and assists the victim who has a life-threatening injury. Which should the nurse do to meet an important standard of care when acting as a good Samaritan at the scene of an accident? 1. Seek consent from the injured party before rendering assistance. 2. Implement every critical care intervention necessary to sustain life. 3. Stay on the scene until another qualified person takes over responsibility. 4. Insist on helping because a nurse is the best qualified person to provide care. The correct answer is 3. Stay on the scene until another qualified person takes over responsibility. When a nurse renders emergency care, the nurse has an ethical responsibility not to abandon the injured person. The nurse should not leave the scene until the injured person leaves or another qualified person assumes responsibility. Depending on the injured person's physical and emotional status, the person may or may not be able to consent to care. The nurse should not attempt interventions that are beyond the scope of nursing practice. The nurse is changing a hydrocolloid antimicrobial barrier, dressing with silver, for a client diagnosed with a stage 4 pressure ulcer. Which intervention should the nurse implement first? 1. Rinse the wound with physiologically normal saline. 2. Remove the old dressing and assess the pressure ulcer. 3. Hold the dressing in place for 5 seconds after applying. 4. Apply sterile gloves when performing the procedure. The correct answer is 2. Remove the old dressing and assess the pressure ulcer. Removing the old dressing and assessing the pressure ulcer for healing is the first intervention. The nurse should rinse the wound with physiologically normal saline, but this is not the first intervention. This dressing must be held in place for 5 seconds after applying it to the pressure ulcer. The dressing change is performed with non-sterile gloves using aseptic technique. Therefore, this is not an appropriate intervention.
The intake nurse is making an assessment of a client who has just arrived at the emergency department. Which of the following comments from this client who is taking phenelzine, a monoamine oxidase inhibitor, for treatment-resistant depression should be given top priority? 1. My bowels haven't moved in the last 2 days. 2. What was my temperature? I'm feeling warm. 3. My legs feel stiff after I sit in the chair for a while. 4. I have a throbbing headache. The correct answer is 4. I have a throbbing headache. Rationale. A serious, life-threatening reaction to MAO inhibitors is hypertensive crisis. Although this medication is inclined to reduce blood pressure, in combination with too much tyramine, blood pressure can rise to a dangerous level. A throbbing headache could be a significant indicator of an impending crisis.
You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.